All right, welcome everybody. I'm Dr. Kevin Connors, and this is going to be a breast cancer prevention, wellness, understanding class. And I want everybody to feel like they're getting what they want to get out of this. So again, at the end, we'll have some Q&A time. And again, if you have questions, feel free to unmute yourself and jump in. A little bit about me. That's a picture of me. I did not want to do a video presentation because quite honestly, I don't, that's the best picture of me I could find. So now you know why I don't do a video presentation. I am the author of a couple of cancer books, several cancer books other than these as well. My first cancer book, The Stop Fighting Cancer and Start Treating the Cause, was published in 2010, I think. I updated it a couple times, and this last version right here, this updated version, just came out just a couple months ago, and I think it's much better and a little bit better organized. It's longer too. It's almost 600 pages. We all this information, so I'm just giving you my disclosures here. All this information is available free on our website. We look at our practice much as a ministry, and we are trying to help people regardless of whether they ever choose our care or not, try to give as much information as possible. Our website is quite robust. All of our books are downloadable as a free download PDF for anybody to utilize as well. Our website is connorsclinic.com on the top of that page. I graduated in 1986 from Northwestern as a chiropractor, really functional medicine doctor. At the time, we didn't use that terminology, but I saw a lot of patients with thyroid issues, hormone issues, things like that. Eventually got into treating cancer through multiple different events. I won't get into that, but went back to school, got a AMA fellowship in functional medicine, anti-aging medicine, integrative cancer therapy, and botanical medicine. So that's kind of my history. I have not been a chiropractor for years. We only see functional medicine patients, mainly cancer, Lyme, chronic Lyme disease, autoimmune disease, but you can check out our website. So let's jump into this. Let's talk about preventing cancer in general, breast cancer more specifically. We're going to zip through some details here first on different types of breast cancer because, you know, these are all things that you can Google on your own and are not helpful for me to waste your time during this presentation. But there are different things that you will want to know about if you're ever diagnosed with a breast cancer or a hormonal, possibly hormonally derived cancer. So there's breast cancer in situ, which is really a grade 1 or stage 0, level cancer that is usually a watch and wait type cancer. And then you have the invasive ductal or lobular carcinomas, and those are graded based upon whether they're hormone, estrogen receptor, or progesterone receptor, or HER2 positive or negative, or if they're negative on all of those three, then that would be called triple negative cancer. And triple negative cancer, if you talk to your oncologist, is usually considered much scarier, much more aggressive, but really technically it's not necessarily any more aggressive as far as its aggressiveness of growth or its rapidity of growth than it is with any of the other cancers, breast cancers. It's just that the hormonally positive cancers like ER positive or PR positive or HER2 positive, they standards of care could use hormone blocking drugs, that class of drugs that can help slow the cancer down. And if you're triple negative, well, that entire class of drugs is basically off the table. So from an oncologist's point of view, as far as treatment of a triple negative, it's a more aggressive cancer because the entire class of drugs that they use in treatment is now set aside, and they can't use that for that cancer. Cancer is then staged. Like I said, stage 0 is typically the in situ cancers. Stage 1 is caught early, and as you go down the stages, stage 2, A and B, the cancer is starting to get larger, and the classifications are based upon the size of the tumor and whether it's spread or not to the lymph nodes. And it gets very technical with the classifications. And again, I'm not going to bore you with all these details because from my standpoint and from the standpoint of this lecture, we're trying to talk about prevention of breast cancer, not so much the details of the stages and how it's classified. So as you go down the stages from stage 0 to stage 4, you're talking about how far it's grown, how much metastasis has taken place. And something that is probably valuable to communicate about metastasis, when you talk about a metastatic cancer, you're talking about that breast cancer that has metastasized to another area of the body through the bloodstream, and it has now settled in the brain or the lungs and the liver or the bones, very common areas for metastasis of breast cancer. But it isn't now brain cancer, nor liver cancer, nor lung cancer. It is the breast cancer cells that are now, you could say, set up home and raising a family in a different organ tissue. So it is still breast cancer, but it's now in the brain breast cancer growing. And I've actually had patients, and there's lots of documentation of this, where a person goes in and they have, inadvertently find a liver mass, do a biopsy of that liver mass, and it's actually breast cancer. And the person doesn't even know that they had a lump, was never diagnosed with breast cancer previous to that. And now, they're diagnosed with breast cancer with mets to the liver. So stage 4 diagnosis before they knew they even had cancer. So that can take place. Now, how metastasis takes place is that primary cancer, in this case, primary to the breast, long before it's at a stage of being diagnosed. So even a stage 0 or stage 1 cancer. So you found a lump in your breast and it's the size of a BB, and you go get it tested. And an MRI is done, or a CT is done, a PET scan is done. In order for cancer to be picked up on an MRI or CT or PET scan, it has to be at least 3 million cells large to be that size. So you have to understand how small a cell is. So as replication takes place, that's what cancer is, and that mass is starting to grow. It has to be pretty darn large before you're going to be able to palpate it. And even if you didn't palpate it, you went in for a mammogram and they found a mass and it wasn't palpable, and you did a CT scan and it was showed up on a CT scan, it still has to be that large, millions of cells large, before it can even be identifiable. Long before it's at that stage, it's giving off what are called circulating tumor cells. Circulating tumor cells do just that. They're also called cancer stem cells. They circulate through the body looking for a place to set up home and raise a family. And the only thing that's keeping those cells at bay from doing what they're trying to do is a healthy immune response to be able to knock those things down. And that is taking place because everybody diagnosed with cancer doesn't end up with metastasis. And certainly everybody diagnosed with cancer, even if they do end up with metastasis, does not end up with metastasis everywhere that those circulating tumor cells have circulated, because they're circulating everywhere. So what's keeping them at bay is your immune system. What's keeping even a growing cancer at bay is a healthy immune response, meaning that all of us, we could say, and there's documentation to show this, have cancer cells growing inside of us all the time. So I guess we really have to start by defining what cancer is if we're going to try to talk about prevention and causes and how are we going to treat this. So what cancer is, so this is a human cell here. What cancer is something either enters into the human cell or affects the outer membrane of the cell to then affect something in the cell, the cytoplasm, these different organelles. You have all these different organelles in the cell. And the most important one when we're talking about cancer is the nucleus, because the nucleus is responsible for replication. And the definition of cancer is a cell that is going through rapid replication. So if a cell is going into rapid replication, it by definition is a cancer cell. Now, remember, cancer is your own cells that something has affected the membrane, usually a receptor on the membrane in hormone receptor positive cancers, or something has gotten into the cell and has affected the nucleus and the replication cycle. Now, normally, a breast cancer cell does replicate itself. I think it's about every 8 to 12 weeks, a breast cancer cell will replicate itself and the mother cell will die. That's how aging takes place. As we replicate cells, those cells are maybe slightly more degenerate than the mother cell, and that's what aging really is. So, but it's only supposed to take place about once every 12 weeks. If it's taking place 3 times a day, that's cancer. So, and the degree of the severity of cancer, we could say, how severe the cancer is, meaning how aggressive the cancer is what is the rate of replication? Is it replicating once every 5 days? Is it replicating 3 times a day? That the rate of replication is really the severity of that primary cancer or that metastasis, because that's the rate of growth. So when we talk about causes of breast cancer, that's what we're talking about. What could cause breast cancer? Well, with hormone-driven breast cancers or hormone-driven prostate cancers or any hormone-driven cancer, you have thousands, millions of different receptor sites for all sorts of different things on the cell membrane. If you have receptor sites for estrogen, for hormones, progesterone, that are affecting the replication of that cell, increasing the replication of that cell, then that is a hormone-positive cancer. Also, so when we talk about causes of cancer, there's almost always multiple causes of cancer. So yes, there can be genetic pieces with tumor suppressor genes, having defects in tumor suppressor genes. I won't get into that. I have videos on our website that talk about that. But really, when we talk about preventable causes of cancer, we have to talk about hormone availability, and we could label as bad estrogens. Won't get into the complete details of that, but think of it as that there's good estrogens and bad estrogens, meaning normal estrogens that are function in our body, and estrogens that are supposed to not stay in a specific state, but they stay in excess in a specific state, that they're called 16-hydroxy estrogens that can attach to these receptor sites and stimulate cell replication. And these are what we could call bad estrogens. So there's ways that we can help eliminate those and help prevent breast cancer. And there's certain lifestyle choices and some things that we can't even prevent in our lifestyle that accelerate increase the number of those bad estrogens in both males and females and could cause issues. So we'll talk a little bit about that. Also, remember I said anything that gets inside the cell that can any way possibly affect either the replication rate or affect negatively the rate of breakdown of a mother cell, apoptosis or cell death of a mother cell, can be a cause or is a cause of cancer. So anything that gets inside of the cell that increases the replication rate is a cause of cancer. It's basically any toxin that you absorb that gets inside of the cell. It could stay there until you're 120 and you die of old age. But if it affects the replication rate, it's a cause of cancer. So that's what we look at in some of the things that we can mitigate. So we talk about different toxins. Well, goodness sakes, they're everywhere. I mean, everybody knows about toxins. There's some that are worse than others that we can deal with and want to deal with. But really, when we talk about toxins, it's not about living a toxin-free life, because that is just simply impossible. It's about trying to mitigate as many things as you can while still living a life and not going crazy. So we don't want anybody to be obsessive compulsive about thinking that they're going to rid their body of toxins and they're going to prevent all cancers, because it's just not possible. We live in a poisonous world. Companies, drug companies, large corporations are spewing out poisons at a rate greater than any time in history. And there's just no way getting around them. Even if you're eating everything organic and you're trying to do everything right, it's just not possible to stay away from toxins. My shirt here is not dyed with blueberries, and the carpet in my office currently is probably gasifying some toxic product, but so is my paint and everything else in my office building here. And I'm breathing those in. So anything that I absorb either through my lungs or that I absorb through consuming orally and eating and through my intestinal tract, either is going to be gotten rid of through my liver and kidneys and deposited in the toilet, or it's going to become a part of me. There's no choice there. It's just one of those two things. And for all the things that become a part of me, as those things build up, my toxic load becomes greater, and the chance of that causing some issues in my body, not always cancer, but the chance that it affects a pathway, affects a genetic pathway, affects a replication pathway, and then be a cause of cancer in my body, increases at the rate of my increase in toxic load. So that's just simple biology there. So the more that I'm poisoned, and the more that I can't get rid of the poisons that I consume, the greater chance that I have of developing cancer and any other autoimmune disease, et cetera. We could go on and on. So one of the ways to mitigate this is to try to be wise about what we do and how we eat and how we live and what we spray on our lawn and what we use for toothpaste, and it goes on and on and on. It doesn't mean that we have to be crazy about it. We don't want to do that, but we certainly want to be wise about it. Then there's biotoxins. So toxins are inert substances, chemicals, etc., like that. Biotoxins are living organisms. So Lyme disease, viruses, bacteria. Yes, bacteria and viruses can enter into a cell and they can affect the replication cycle. H. pylori is a gram-negative bacteria that's actually in your normal gut flora, but if it gets in excess amount, it can cause all sorts of problems. It's the #1 cause of stomach ulcers, and according to the World Health Organization, it's the #1 cause of stomach cancer worldwide. As it gets inside the cell itself, it affects all sorts of issues. It can affect production of HCl. It can affect the health of the cell, and if it affects replication cycles, it can cause cancer. But any bacteria can, any virus can, again, any toxin can. Again, quite simple, anything that gets inside the cell that can affect replication cycles can be a cause of cancer. And of course, we talked about hormone receptors. So different hormone receptors on your cell membranes. If they're accelerated, if you're exposed to a lot of these bad hormones on a continual basis, you will upregulate the number of hormone, those estrogen receptors on your cell membrane, trying to grab the good hormones, and that blockage of that when the bad hormones is 16-hydroxyestradiones attached to those cell membrane receptors, they actually block apoptosis. That's what's actually taking place. So when a woman does have breast cancer, they're given aromatase inhibitors and such. What those drugs do are dislodge the bad estrogens from those estrogen receptors, so that apoptosis can take place. And those drugs do work. Now, there's some natural things that you can do prior to getting breast cancer, or even when you have breast cancer, even taking along with the drugs, that can be very beneficial too, and we'll talk about those. So anything that's going to affect the cell membrane or the cell nucleus and increase replication is a cause of cancer. Quite simple. Okay. So, still with me? How do we diagnose breast cancer? So diagnostic imaging is the #1 way to diagnose whether there's a lesion or not. Of course, I left off just palpation. So doing regular breast exams can be beneficial to find out, do I have anything going on? Now, personally, I'm not a fan of a mammography. It's going to diagnose later stage lesions. Now, I do have patients that have been diagnosed initially through mammography. I think there's a better way we'll talk about in just a minute. The reason why I don't like it is the amount of radiation that's involved with that. Ultrasound is a great tool because there's no radiation. There's really no downside of ultrasound. Um, and understand any of these imaging things and the ones on this side. Oh, I didn't have CT on this, but CT is another one. So any imaging, X-ray, CT, ultrasound, or mammogram are simply going to say, hey, there's a lesion there. It's not going to tell us what it is. It could be a cyst. It doesn't necessarily mean that it's cancer. So the only way to know if it's cancer or not is to get a biopsy. You need to get a biopsy of the tissue to know whether it's cancer. That's the only legal way to know if it's cancer. Though on CTs, honestly, a good radiologist can say, hey, that is definitely cancer or not. Of course, legally, they will say, this is suggestive of cancer. You should get a biopsy. So, but there is, as you look at that, what you're looking at. Lab tests will not necessarily say that you have cancer or not, but there are different tumor markers that are really good for identifying cancer. And there are some other alternative type lab tests if a person is like, I do not want to get a biopsy. We have some patients that have come to us that just, do not want to get a biopsy. Is there a negative about getting a biopsy? There's documented evidence that if the tumor is deep in the breast and you're going to stick a needle in there to insert into the tumor, and then you're going to draw out some tissue, and then you're going to draw that needle back, you are going to leave cells from that point of that lesion all the way through the breast till you exit the breast tissue. So does it increase the spread of cancer? The answer is technically yes, it does. But really to the degree of the depth of the tumor. So if the tumor is near the surface, chance of spreading cancer or increasing metastasis is very slim. If the tumor is very deep, the chance is higher. But again, you have to weigh and balance that out with, I want to know whether I have cancer or not. So if you're going to treat through standards of care, meaning if you're going to treat through your oncologist and get chemo or radiation or surgery, a biopsy is absolutely necessary. If you're going to do alternative things alone, then a biopsy isn't as necessary because you're not so concerned with the diagnosis. Lab tests, we have a list of different tumor markers on our website if you want to dig into that a little bit deeper. But there are specific blood tests, different proteins that are emitted from cancer cells that can give you a very strong indication, because there's a normal range for them, whether a person has cancer or not. Those are what are called tumor marker tests. Now, many times you have to ask for those tumor marker tests to be run. And many times your insurance won't pay for tumor marker tests unless you already have a biopsy showing that you have a tumor. But you can get tumor marker tests run. Maybe if you pay for them, they're not very expensive tests. Prior to getting a biopsy. And even if you have a biopsy and you are going through standards of care treatment, it doesn't mean you're going to get any tumor marker tests done. And the reason is that if you're going through standards of care and you're doing chemotherapy will typically spike tumor marker tests, because chemotherapy, if it is killing the cancer cell, it will emit a lot of the tumor marker proteins. And oncologists, quite frankly, don't like to sit down and have that discussion with the patient saying, I'm sorry, your tumor markers are really high, but don't worry, the cancer is dying. That this just means that the cancer is dying quickly. And it gets to be where it's complicated for that oncologist. So a lot of oncologists today don't run tumor marker tests. You have to ask for them. But I highly suggest you ask for them, because they can be valuable markers to guide your care. There is another way, I said, other than starting with a mammography, that is much less invasive, and that is thermography. So thermography, we do that in our office. There's multiple places that do thermography. Make sure you contact our clinic about. There's only one thermographic unit that is FDA approved. That would be a little caveat. But thermography registers heat. So when a cancer, when a cell group is rapidly replicated, rapid replication produces heat. So this is a very, very sensitive test. It is very non-specific to cancer, though. So here's a picture of a thermography of anterior to posterior of a woman. Her left side, there's a lot of heat here. So white is going to be the hottest. Red is going to be next hottest. There's always going to be heat under the breast just because of the breast tissue, but there's definitely something going on in the left breast. That doesn't tell us what. So what is thermography as a diagnosis of breast cancer? No, it's a great screening tool. So you could use this as a screening tool. Why is it a great screening tool? Because it is much more sensitive than mammography. It will catch things that mammography doesn't catch. Matter of fact, years ago when thermography came out, it was highly ridiculed through several papers in, I think, the British Journal of Medicine, that they did a study and they took women off the street. And I can't remember the details of the study, but they said it found things that didn't exist because it found hot spots like this. And then they went in and did a mammography and it was negative. And they ridiculed the study. Well, 5 years later, that was followed up, and every single woman that had a hot spot on that study that they ridiculed was later found to have cancer in that spot. So the problem with thermography is it's catching things really early. Well, is that a problem? I don't think so. So we want to catch things really early so you could do some things to prevent cancer. Remember, cancer has to be 3 million cells large for it to be picked up on a CT scan or a PET scan. It has to be larger than that to be picked up on a mammography. So if you can pick it up long before it's 3 million cells large and start to do some things of your choice, different preventative things, you'd be much better off, I think. So thermography is a really nice tool. The other really nice thing about thermography is that it's non-invasive. There's no radiation involved. It's simply a picture. When we do thermography, we could easily look at them. You could easily see things, but these are also sent to a radiologist. So they're read by a licensed radiologist. So mammography or thermography has come a long way. So next, care of breast cancer. So what would you do to take care of breast cancer? Well, standards of care are standards of care. This is what what your oncologist is going to do. Chemotherapy, radiation, surgery, and usually something in that order. Typically now, even if you have a small mass, it used to be if you had a very small mass, smaller than BB size, going in and doing a lumpectomy and then talking about possible chemotherapy was a choice. In the last couple of years, they've kind of reversed course, and typically you're going to be asked to do chemotherapy first, and then they'll talk about some type of surgery, either mastectomy or a lumpectomy, depending on the size of the tumor. If you do a lumpectomy and not a mastectomy, then they're going to suggest radiation if you do a mastectomy. Usually you can skip the radiation. Now, remember I said suggest. Usually, though, if anybody on this call has had experience with a diagnosis of cancer, it is saying that it's a suggestion is a mild misnomer, because usually there's a lot of pressure, a lot of fear that's involved. It's not very fun to hear that you have the C word. And sometimes, let's say, that might be taken advantage of. I'm not saying chemotherapy and surgery, radiation aren't in your best interest, but I don't think it's in anybody's best interest to use fear as a tactic to manipulate somebody into a level of care when you always have more time to think about and pray about and decide what you're supposed to do. But this is what you're going to be offered in standards of care. We have a lot of patients that are doing standards of care along with what we do. This is not what we do. So we aren't offering chemotherapy, radiation, surgery. We're doing the alternative things in our office, which can be extremely complementary and help a person get through these things should they choose to do these things. Now, I will admit a lot of our patients have already gone this route, and there are patients because it didn't work and now they're seeking other things. Because normally, when a person hears you have cancer, Mrs. Jones, oh my word, they're not like, oh my, well, that's interesting. I better go home and research the subject. No, they're like in shock. And the oncologist says, we need to get a PICC line put in right away, and we need to do this, and we need to do that, and this is what we're going to schedule you for, and make sure you get scheduled at the front desk before you leave. And you are getting a port placed the next day and chemotherapy next week. So that's not an uncommon scenario, believe it or not. So people tend to be, rushed down a pathway that maybe they would have thought about it, would have maybe done some other things too. That's why hopefully you're at this presentation so you can think through these things prior to ever receiving a cancer diagnosis. And that's what we want. So what do we do? And this is what we're going to talk about with some things that other options that you have and preventative options that you have, and then we'll open it up for questions. Care of breast cancer from an alternative standpoint is talking about nutrition. When I say nutrition, I'm talking about nutraceuticals, herbs, different off-label drugs to use to slow growth and to decrease growth and to stimulate an immune response, because it is all about your immune system recognizing the cancer as an enemy. Remember, the cancer is your own cell going through rapid replication. That's the difficult time that you have dealing with cancer. Why is your immune system killing it in the first place? Is my immune system really suppressed? I mean, I don't get sick very often. Why isn't it killing the cancer? Well, big reason why it doesn't kill the cancer is because it's your own cells. And your immune system isn't supposed to kill your own cells. So stimulating your immune system with specific herbs and nutrition can be very important. Diet can be very important. Not always, it's not everything, but it can be important. And the reason why we look at diet is we want to look at every cancer that's growing has a fuel source. If you can cut off its fuel source, then you can slow the growth of the cancer. So the nutrition and the technology can help. Technology, we use a bunch of different types of therapy in our office, and our favorite therapy that we've used since I started helping people with cancer back in the late 1990s is this machine that you see in this picture. This is called a Rife machine, R-I-F-E. It was named after Royal Rife, who back in the 1920s, 30s, and 40s researched it while quantum physics was just in its burgeoning. So he realized that everything has its own frequency, vibrates at its own frequency. If you could hit cancer at its own frequency, could you not help the body kill the cancer? Well, that has been proven, and it's been proven through our office. My first cancer patient that we ever had was literally delivered by God. She was a chiropractic patient of mine, and she came into me and she said, I have to tell you something. I have breast cancer in both breasts. They want to do chemo and radiation. They said, if I don't do chemo and radiation surgery, I have 3 months to live, and I'm not doing it. She did do the surgery, but she did not do chemo and radiation. She started with me with a Rife machine. I didn't even have a Rife machine at the time, but I have been researching Rife machines and been in love with Rife machines. And that was my aha moment to buy a Rife machine and get started with this gal with a Rife machine. She lived another 13 years. She ended up dying of a metastasis, but from 3 months to 13 years, I think that's a pretty cool success story. And that was really our stepping stone into taking care of cancer, and what really pushed me to go back and get my other AMA fellowships in functional medicine and cancer. So yeah, I really am thankful to God for that, but I'm thankful that he led me to the Rife machine, because that has been really a great tool. Though it's not a magic wand and it's not a cure-all, there is none. Beware of things you see on Facebook that this nutrition kills 97% of cancer, and test tubes or in petri dishes. Well, anything is going to kill 97% of cancer in a petri dish. What does it do in your body? Nothing works perfectly for everybody. That's why I got this book, because there's a zillion things that could be possibly good for your cancer and not good for my cancer. So you have to test those things. So I am not a person that thinks that chemo and radiation surgery is bad. I'm a person that thinks that you should always do alternative nutrition, diet, technology. Adding chemo and surgery and radiation might be the absolute another tool for you. You have to use wisdom in your decision-making process, and I don't think anybody should make decisions based on fear. So what else? Look at this book. It's a free download. I don't get anything from you downloading it. I think chapter 5, section 5 goes through about 100 different nutritional pieces of dealing with cancer and different supplements that might be very beneficial. But let's get into some of the other preventative things. You also have to remember that cancer cells do not exist in isolation. So there's all sorts of things going on in your body. There's all sorts of other pieces of the puzzle that also increase a person's risk of cancer and increase a person's and decrease a person's ability to be able to fight it. So it gets extremely complicated. I wish it was super easy. Just take this and you're going to be fine. It cures everybody. Unfortunately, whenever anybody gets a diagnosis of cancer, uncle, Bob's, friends, nephews, cousin calls you and says, my aunt's sister used this and it cured her cancer and now she's cancer free. Well, that might be true for that person, but doesn't mean it's going to work for all of us. So nothing ever does. There's just a lot of factors that you want to look at and try to investigate. We talk about preventing cancer. You have to look at just the whole body health, and the more holistic you can look at the body, the more I tell people to take a 30,000 foot elevation height and looking at a person's body and everything that's going on is going to be best. And I know we could get super complicated. This is one chart here that I go over a lot in some of my presentations with patients, because there's so many different factors that affect growth. Now, in this chart, this centerpiece here is called mTOR. This is actually a genetic pathway for growth. And you can see that, let's just use an example here. Dairy, eating dairy, cow's milk, increases IGF-1, increases hormones, increases amino acid that all stimulate mTOR that increase growth. So we can go through each one of these different pathways as far as talking about preventing cancer. Any ways that we can decrease mTOR, we are going to help decrease cancer growth if I have cancer, but we're also going to decrease the chance of me getting cancer. Remember, we might all have cancer growing inside of us and our immune system is killing it. And we certainly don't want to be throwing gasoline, mTOR, on the fire of stimulating growth. So we could spend literally an hour on each one of these little yellow boxes around here and talk about how each one of these stimulate growth pathways. Now, the numbers here are genes that goes through. So when we look at a person, we actually do a full genetic workup, not just tumor suppressor genes, but we look at all these different genes that stimulate mTOR. So if a person, these are other factors that a person has. So we all have toxins that get in our cell that can affect replication cycles. And then if I have combined with that, with the increased toxic load, combine that with the decreased ability to detoxify because of maybe genetic pathways or issues with my liver, combine that with HFE defects, so my iron is stimulating mTOR where it shouldn't be, then these are the big pictures that we want to look at, that we can intervene here as we look at those genetic defects to help decrease that load, that burden on the person's body, so that their immune system can actually work to help reverse this or to prevent it. So it gets very complicated, I understand. I'm trying to zip through this and not bore you, but now let's get into some very specific and very simple ways to help deal with this. We actually have a breast cancer prevention bundle on our store. So on our website, we have a store that we sell some products. I'm going to go through the what's in these products. You don't have to buy them from us. I'm not trying to sell you anything. But these are great things to consider when you're trying to prevent disease. So when we're talking about preventing cancer, we're trying to stimulate an immune response. So, so some of the things that are in these products will help do that and to help get rid of, remember, bad estrogens. So in this first product, the Breast Defend product, there are turmeric, curcumin, different inflammatory herbs, quercetin and such, that will help decrease inflammation. There's astragalus in here, that's an immune product too. But this is a mixture of different things that will stimulate an immune response and decrease inflammation. So chronic inflammation, we really talk about that as another source of something that would block an immune response to a growing cancer. So a growing, replicating cell structure is going to give off a lot of waste. That waste is going to form like basically an inflammatory slime layer around that growing cancer, which is another reason why my immune system isn't able to kill that cancer. So if I could get rid of that waste around there, that inflammation around there, I'm going to be able to better elicit an immune response, T-cell macrophage response to help kill that cancer. So taking anti-inflammatories can be extremely beneficial. There's a lot on the market. This product just has some of those in there. This product also has some mushrooms in there. So organic mushrooms, Coriolis versicolor, reishi mushroom, are immune stimulants. Those are polysaccharides that are in that mushroom that help stimulate an immune response. And if you do read my book, you're going to find that polysaccharides in the form of mushrooms, in the form of aloe, are one of the best things that test for most of our cancer patients. A lot of our cancer patients, they're one of my favorite things to use as far as a cancer killer. So again, we want to decrease the inflammation around a growing cancer. We want to increase the immune response. So even if I don't have cancer, those are good things to do. So even if I don't have a diagnosis of cancer, doesn't mean I don't have a cancer that's growing in me, that my immune system is maybe winning that battle right now. Well, this is something like this is going to help my immune system win that battle. Again, you don't have to use this product, but think of things like a curcumin or turmeric, quercetin, astragalus. Those are things that will help decrease that. Boswellia. And then medicinal mushrooms. You want to get a good quality medicinal mushroom. It's really important. And then this product, DIM, you probably heard of that, is something that is good for literally everybody to take, especially every woman to take. Now, DIM is a scavenger of bad estrogens. That's why. So anything that's going to scavenge bad estrogens and help pull bad estrogens out of a person's body, the better, because we're exposed to them constantly. And we're talking about bad estrogens. It's like you can run, but you cannot hide. I don't care how organic of a lifestyle you live, you're producing and you're exposed to and absorbing bad estrogens. They're literally everywhere. So hormone disruptors are everywhere. So anything you could do to help pull those out of the body, the better off you're going to do. Also, this product here, this is the sulforizyme. The sulforizyme is actually a product of broccoli sprouts. And this is, I think, the best sulforizyme on the market because this is the most researched. And that is fantastic for helping pull bad estrogens out and help balance estrogens and to just help balance the hormonal system. This is good for both males and females. A great product, one of our larger sellers, actually. And then this last one, this is the I can't see it very well, but it's EstroClear. We actually have a new label. We have to change that. But it is EstroClear. It is a spruce lignin extract. A lot of research on that, really interesting. That's another puller of bad estrogen. So that's another natural aromatase inhibitor is what it is. Great product to take on a regular basis too, to help, again, do everything you can to decrease that bad estrogen load. That can be a stimulator and a growth factor in any cancer, any hormonally driven cancers, including male cancers, not just breast cancer. But these are some good things to take. Now we could go on, there's a ton of good things to take, and I would go back and suggest just going back to this book again. So now let's open it up for questions and answers. I did click on that participants can unmute themselves, but if you are having difficulty doing so, then feel free to raise your chat hand, or you can chat me a question as well.
Dr. Connors, is there a world in which you would say somebody at as early on as can be, who's going to have a lumpectomy, could go without having to have the radiation?
So is your question, because I'm doing a lumpectomy, do I have to do radiation?
Yeah, it felt like it was a forced thing, like it wasn't an option. And yeah.
Yes. So I am not a fan. So again, I have mixed feelings about radiation. So I think radiation to bone, if cancer metastasizes to bone, can be a good thing. We have had mixed results with that with our patients, but mainly good results. If a person has metastasis to the bone that has, typically it's going to be the spine, and they have horrible amount of pain. We've seen people in 3, 4, 5 sessions completely get pain-free doing that. Radiation to soft tissue, I'm not a fan of. There's going to be a lot of collateral damage. Basically, if you ask, why are you radiating the soft tissue after you do a lumpectomy, they're trying to kill scavenge cells that they can't see. Remember, a cell is not visible. A grouping of cells, even if it's 100,000 cells, is not going to be visible by a surgeon. So they're not going to be able to see that. So their idea is we're going to radiate the area. So if there's groupings, which there is going to be, of cells, I should say that cautiously, most of the time there's going to be cells that are still there that are cancerous. The idea is that we're going to radiate it and it's going to kill all those cancer cells. Well, the truth is that you're damaging other cells too, and you're increasing the risk of because you're damaging cells, you're increasing the risk that metastasis in those damaged cells goes higher. You do any research, you'll see that radiation post breast cancer increases the risk of melanoma, cancer to the skin, because of that radiation. So I am personally not a fan of radiating soft tissue. That has been a practice just in recent years. And just because something this is what we always do, does not mean it's what you need to do. And again, you've experienced what I shared earlier, is that you typically are not given much of a choice by your oncologist. You have got to stand on your own 2 feet and say, listen, thank you very much, but I'm going to do some research and I'll let you know when I'm ready for that. If your oncologist is a my way or the highway kind of person, you could pick another oncologist. The Twin Cities have thousands of them here. Find somebody else within the group, go to Mayo, go somewhere else. Tell them your experience. Usually you'll be, oh, we'll do whatever you want. We'll take care of you. That's my suggestion. Make your own decisions. Don't let somebody else guide your care or tell you what you have to do. You have to be your own advocate. So yeah, in a perfect world, which we don't live in a perfect world, they would be more kind to you and offer suggestions. That's typically what's not done today. You have to be your own advocate and say, listen, thank you for your suggestions. I'll let you know when I'm ready for that. And I'll call you when I'm ready. So don't let anybody bully you into anything. Okay, some questions that came into the chat. Are there side effects in the research for the supplements that you showed? So the supplements that I showed here, no, there can be side effects in any supplements if you take them in excess. So if you're like, oh, people think, well, if this says 4 capsules, so if I really want to prevent breast cancer, so I'm going to take 30 capsules a day. Could there be side effects from that? Well, quite honestly, from taking 30 capsules of this, probably not. But other supplements, yes. So yes, they're in moderation. The other thing I will warn you about supplements, and I'm not pushing our supplements, but supplements it's not a good business model out there, because there's a lot of supplements. There's been studies. There was a study 2 years ago where they went into a Walmart, Target, a GNC, and another place, and they got ashwagandha and milk thistle and a couple other herbal supplements. The highest supplement contained 20% of what was on the label. It was unbelievable. So you have to get reputable companies, reputable supplements. There's a lot of people that come into us that are taking supplements that, quite honestly, we throw in the garbage can. They're completely worthless. So you have to make sure you get reputable supplements. And even buying on Amazon, you got to be careful, because there are Chinese companies that will buy a bottle of Echo Nugenics Breast Defend, copy the label, fill it with rice, capsules with rice, use the same bottles, and sell them on Amazon. I kid you not. So you do have to be careful where you buy your stuff and the quality of supplements that you buy. I'm a really big stickler on that. So yes, there are research on overconsumption of certain supplements, and you have to be careful of that. You only want to use them as directed, or as directed by a physician, but you don't want to be taking supplements that you're just buying online. So you got to be careful of that. Next question. What are your thoughts on personal care products like deodorant and antiperspirants that contain aluminum? Well, that goes back to the toxicity piece here. So all these different toxins that we're exposed to on a daily basis. I just pulled this picture off the internet here. We could add probably 1,000 more pictures here. So yes, I am not a fan of aluminum in antiperspirants. Unfortunately, you women are clobbered with this stuff, because in regular Target line, you probably don't get many natural choices. I think there are some now, but chemicals, period, are estrogen disruptors, are cell disruptors, and are toxins that get inside the cells. So you want to absolutely steer clear of antiperspirants that contain aluminum. Okay, next. I think that's all the questions I have on the chat. So any other questions? If we have a couple minutes left.
When somebody is diagnosed and you do walk in, you're completely caught off guard and you don't have any experience with this, so you just do what they tell you. Not to do that is probably the most important thing you could have said to us today. But any thoughts on where a person starts? I think your website, I assume, is where you would say start here, but like any recommendations for advocate or
Yeah, I mean, we're certainly not the only clinic out there that's trying to help people, and there's just tons of information out there. I think that the smartest thing that a person can do when you go in and I have a lump and you do, let's say, a biopsy, you get to the point of biopsy and they say you have cancer, you should very kindly and sweetly say, thank you very much, thank you for the options, I'll let you know. I literally have had patients say that to their doctor. Walk out. This actually happened to my sister. As she was walking out to the car, the front desk called her to schedule her next step. And she's like, I just told you I'm going to call you. There can be clinics that are very kind and sweet about it, but what we've experienced is very, very, very high pressure sales, which to me, that should not be in a clinic whatsoever. if you're there for people's best interest. The biggest piece of advice that I could give you is to slow down. You have to slow down. You always have more time than you think. I don't care if I can't tell you how many times we say, the doctor said I have the most aggressive cancer possible. Oh, give me how does he know? There's no way to know that unless he has a before picture of a CT scan 3 months ago and it's tripled in size in 3 months. Yeah, it's pretty aggressive. You need to do something. But you don't have a before picture. They don't have any idea how long it's been there. It could have been progressing for the last 20 years. Usually it's been at least 5 years. Slow down, take a deep breath, say, thank you very much. I'll call you. If the clinic calls you on your way out to the car, don't answer the phone. Don't let them make appointments for you. Just expect it. Don't let anybody bully you. Do not let anybody bully you. If you need to bring some other stronger advocate with you into the picture that's going to answer the phone for you and say, hey, I'm Mary's friend, don't call her. She'll call you. Can't you just respect that? So it's unbelievable what we've heard. So please just slow down. You know, yes, there's the truthaboutcancer.com. There's Cancer Tutor out there. There's other great websites that are just informational websites. You know, we want our site to be mainly informational and a blessing to people who would never choose to come to us. We have tens of thousands of downloads of my first book, and we're going to have hopefully 100,000 downloads of this book because I think it's so much better. Start reading, start doing your research. You have time to make a decision. Don't let anybody push you into anything. Another question, are there concerns with mammograms and cancer, especially since mammograms are used as preventative screening? Yes, I think there's a huge concern with that. Mammograms are a lot of radiation. Radiation damages cells. Anything that damages cells increases likelihood of cancer developing. So I think a way better way to go is thermography as screening. Completely non-invasive. You could do this every day if you want. There's not going to be any harm. Of course, you don't do it every day. You do one thermography screening, you do another one in 3 months to get a baseline. And if everything comes back, you will have each breast will be graded on a scale of 1 to 5. If you're in there's no signs of anything stage, they're going to suggest you get screened again in a year. So it's easy to do. There's lots of thermography clinics around. There's 3 thermographers in the Twin Cities. One great gal goes clinic to clinic on the west side of the cities. We just do it just in our office, and then there's somebody else in Rochester. So I think this is a much better way to go. You add up the radiation and in mammograms on an annual or every other year basis over the course of 10 years, you have a lot of radiation that you're dealing with. And then another question came in, are you against fluoride in toothpaste or just fluoridated water? I am against both. When we lived in the city, we used a filtration system to filter out the fluoride for our drinking water. We have never bought fluoride toothpaste, at least for the last 20 years. Fluoride is a toxin. It's a neurotoxin. And you just can't argue with me that. The facts are out there. Why it's still in our water, it's I don't want to get in that discussion. It's crazy. So yes, you should not be drinking fluoridated water. Drinking it once in a while, is that going to kill you? No. So what you just, again, you have that balance. You try to do the right thing 80 to 90% of the time. So you just try to do your best job. Okay, I think, let's see. I think that was all the questions on the chat. We're done with our hour. You probably have to get back to work. We had a ton of information here. Apologize for cruising through it so long. For those that are still on the call here, thank you for listening. Please, feel free to go to our website, download our books. We have books on other subjects too. Again, we're just here to give out information. I have a ton of videos. I must have 400 videos on our YouTube channel if it's easier to watch videos. And at least 400 blogs on our blog page too. All right, I hope this was a blessing, and I will hopefully be invited back. We can talk more. Thank you very much. Appreciate it.